almost a year since the WHO African region has been certified wild polio virus free. The Global Polio Eradication Initiative, that is set to give an update on its work since certification. But to discuss this further, we're now joined by the chairperson of Rotary International, Dr. Tunji Funsho. Doc, thank you for your time and a warm good morning to you. Let's talk about this. I mean, it seems that on the 25th of August, it marked exactly 1 year, according to my understanding, since the World Health Organization Africa region actually certified wild polio virus free. Let's talk about that just in terms of what this then means for the health fraternity and the work they have done to see this progress.
Good morning, and thank you for having me on your morning show. Yes, it is quite gratifying that after a lot of hard work on the part of the government and global polio eradication partners, Nigeria, and as a consequence of that, Africa was able to be certified polio-free on the 25th of August last year. And we're looking forward to the 1 year mark, during which period we have continued to ensure that we keep Africa at zero. It is quite a joyful thing to see us to this point, but not without some challenges.
And let's talk about those challenges, Dr. Funsho. I mean, surely even with the certification, there were challenges. Take me through what some of them were.
Well, one of the major challenges, have been to ensure that children are optimally immunized, so that if the virus finds its way back into Africa from any source, since we still have the wild polio virus in Afghanistan and Pakistan, though to a much lesser level this year than last year, the children, will be immunized and the virus will not infect them. Unfortunately, our coverage for polio across Africa is still quite low. We need to get to a threshold of at least 70% of all children immunized to have the total confidence, that even if there's an imported virus, children will not be affected. The second challenge, of course, that you may be aware of is that we've been having challenge of the vaccine-derived polio virus, which cut across a lot of countries in Africa, particularly Western Africa and the Horn of Africa, which we are tackling with new technologies and new techniques.
With that being said, I know that information on polio is still important, even with this progress, awareness, as well as, just health and medical, interventions that still need to be discussed. I suppose that's why the Global Polio Eradication Initiative is expected then to host that media briefing on polio eradication efforts. Let's just talk about what's expected to be discussed there.
Well, we would keep up to date information about what is happening globally about polio eradication, but much more importantly in Africa, discuss our challenges, discuss new technologies and innovations that have been brought to bear, and also discuss the integration, of other health interventions into the healthcare system, including, polio vaccines, and of course, how the COVID-19 pandemic has impacted in some ways negatively, in some ways positively on the polio eradication initiative, and how we have been able to leverage our experience, skills, and resources in polio eradication in the containment of COVID-19 pandemic in Africa.
With that being said, as we talk about, the media briefing, we'll talk about the certification and the progress made. Doc, I can't ignore this new strain and this new strain or variant, rather, of, polio. I know that in a press statement, from the Ministry of Health back in the 12th of August in Uganda, I mean, they said they're experiencing an outbreak of a strain of polio dubbed, and I quote, a vaccine-derived polio virus type 2. What threat does this pose to the strides and the efforts currently being made to continue making sure that Africa is polio-free?
Well, Africa, currently is wild polio-free. What you're referring to is what I spoke about as to, the kind of update we'll be given this afternoon. This strain, the vaccine-derived poliovirus type 2, has been around us, for a couple of years, in fact more. And we have, as a consequence of that, developed a new vaccine, which is specifically targeted at this new variant. You see, the thing about vaccines, about viruses, is that the longer they remain in an environment and they find a host repeatedly, the more likely they are trying to mutate so they can survive long term. And what is happening in most parts of Africa that has been affected by this is that, as I mentioned earlier, the immunization rate is low. There are a huge percentage of children who have not received any polio vaccine whatsoever. And also, we even in those who are vaccinated, we switched to the bivalent vaccines. We had removed the type 2 vaccines from circulation. So a swath of children actually did not get the at all. So and in an environment with unsanitary conditions, with unimmunized children, it is quite easy for that virus to find repeated passage, through the gut of children, and in that process, try to survive by mutating into this new variant that we're dealing with now. It's a much more stable vaccine that is much, much less likely to mutate in the long term.
All right. Well, we appreciate that clarity, and talking to us as well, Dr. Tunji Funsho, from the Rotary International. Appreciate your time this morning.